So osteoporosis, this is the Monarch Notes osteoporosis talk. We will hit on some of the highlights. It is, I usually give this talk in about 3 hours and then about 4 hours of questions. So as you can tell, we're going to whiz through this quickly, and at the end I'll give you the real answer, and that is the internet. But I'll give you that in a minute. So what is osteoporosis? First of all, osteoporosis is a loss of bone mineral density. Essentially, it is a leaching of the calcium out of your bones that weaken your bones. And I have to put this slide in because I spend every day talking about this slide. People come in and say, well, my hand hurt, it must be osteoporosis. I go, nope, that's not osteoporosis. Osteoporosis is painless. Let's start with that. People don't know they have osteoporosis unless somebody's done a bone density or something like that. It's age-related. It's usually female more than male. And in this one situation, being a little overweight is a better idea. Osteoarthritis, there, I found it. So now you can go out and have that dessert this afternoon. Osteoarthritis, that is a painful swelling of joints. It also is age-related. It tends to be gender-neutral. Some people say a little more male-dominated. And increased weight is a bad idea. So if you got bad knees, this is not a good thing to go have lunch today. So what is bone? Well, everybody thinks bones are just there. They're solid, hard things that hold you up, but that's not true. Bone structures are dynamic. They're constantly building bone and breaking bone down. As a matter of fact, when you're really young, you turn over your bone in about 8 months. So your whole skeleton changes. Well, that changes as we get a little older. We hit a peak bone mass between 25 and 30. Some people say osteoporosis is actually a pediatric illness. If you don't build the bone now, you won't have it later. And so you can see here some pictures of osteoporotic bone. Normal bone is a nice honeycomb. It's strong. It's got a lot of internal support. Osteoporotic bone is missing all that internal support. The bone gets weak, and it is prone to fracture. There is an actual definition of osteoporosis, and these two slides tell you what the World Health Organization has defined as osteoporosis. On a bell curve, on a bone density, this is all based on DEXA scanning. All these other types of bone scanning are not really useful in comparing osteoporosis. As a matter of fact, it even goes as far as a bone density scan on the same machine. Some people say you should go back to the same facility because there's a variation even among machines. But if you have, so on this bell curve, this DEXA scan reads out a number. If you're 0, that's pretty normal. If you're under about 0 to 1, then you're getting into the, that's normal. Then beyond that, you're in the osteopenia range. Osteopenia is on your way to osteoporosis. It's weak, but it's not defined as osteoporosis. The World Health Organization defines the word osteoporosis as more than 2.5 standard deviations below the norm. Now, interestingly enough, this is a funny little fact, the norm was done in Texas. There were 6,000 bone densities done of normal people in Texas. I don't know why they picked Texas, but they did, and that's where the norms came from. So it's a statistical analysis, but below 2.5 standard deviations, you have osteoporosis. So how big a problem is this? It's a huge problem. 52 million people in the world today have osteoporosis. 50% of women over the age of 50 will have an osteoporotic fracture. So half of you will show up in my office with an osteoporotic fracture if you don't do something about this. I always tell people in my lecture, if you see me, you didn't listen. 2 million people break bones a year, and 3 million by 2025. This is a huge healthcare issue. We could probably balance the healthcare budget on this. $19 billion of healthcare dollars are spent on osteoporosis a year, and by 2025, 25.3 billion, so says the Center for Disease Control. Why women? Why isn't it everybody? So 80% of the 10 million people in osteoporosis are women. They're smaller generally. They're thinner boned. And the big issue is obviously menopause. So there's a sharp decrease in estrogens in menopause. Men don't really go through this, although if you ask their wives, they would say they do. But in the first 5 to 7 years after menopause, women generally lose about 20% of their bone density because of the loss of estrogen. And this has become a big issue because estrogen supplementation was very popular for a long time. It's become not popular recently because of the risks in strokes and heart attacks. And we'll talk a little bit about this, but I only have 10 minutes. So what are the risk factors? Here they are. Female, we talked about that. Small stature. Family history, very big thing. If your grandmother was all hunched over, you're on your way. So you need to do something about this. If you're white and Asian, you're in trouble. If you're black, you're better off. And a tan doesn't help this very much. Alcohol consumption and smoking are a bad idea. Sedentary lifestyle, you need to exercise. Eating disorder, huge issue among athletes and young women today. Diet, some diets are not good for osteoporosis. You have to look for that. GI problems, malabsorption syndromes, lactose intolerance, a huge issue that we probably seeing a little more of today. If your children can't tolerate milk, they need supplementation. There are other reasons to have osteoporosis, and they're not all just postmenopausal. Kidney problems, medications, vitamin D deficiency. So all of these are risk factors, and I could keep going. Again, I only had 10 minutes. Why are orthopedists involved in this? Because if you see me with your first osteoporotic fracture, first of all, you missed this talk. And secondly, you're on your way to a second. Because if you have one osteoporotic fracture, you're twice as likely to have a second one. So there is a huge push to identify people that come in with broken bones. Even if you slipped and fell in the winter and you broke your wrist, that may be the beginning of your osteoporosis diagnosis, that you may never realize it. And you don't have to be 95 to have this problem. You can be in your 50s. You can even be younger than that. So what are the common fractures that we see in osteoporosis? Well, the big one that nobody wants is a hip fracture. They all require surgery. The morbidity and mortality is immense, and the rehab and loss of independence is enormous. And these are the healthcare dollars being spent. A wrist fracture, as I said, if you fall from just a standing height, most people won't break their wrist. If you did, you probably have osteoporosis, or at least we have to prove you don't. Pelvis fractures, there's another one. You fall, it hurts. You go into the emergency room, you didn't have a broken hip, but you had a broken pelvis. That's a problem. Spine fractures, these are very common. These are the hunched over old ladies who have progressive spine fractures. And Dr. Fiore, one of my partners, is going to talk to you about the management of osteoporotic compression fractures. So what do we do? What is the treatment? Well, weight-bearing exercise, that's the easy one. You need to get out and walk. Swimming doesn't work very well. A bike doesn't work very well. Get out and walk. You don't have to run necessarily. You need to walk. Some people carry weights to increase their weight-bearing. So some sort of weight-bearing exercise. Calcium. So here's the good news. Calcium helps, but calcium doesn't reverse osteoporosis. You can't take an osteoporotic person, give them calcium, and fix them. That doesn't help. So you need an adequate dose of calcium throughout your life. And if you're lactating, if you're young, as you get older, you need increased calcium. So it goes anywhere from 1,200 to 1,600 milligrams a day you need calcium. There are lots of ways to get it. There are better calcium sources than others. You need something that dissolves. If you take your calcium pill and stick it in a glass of vinegar and it's still there in 5 minutes, go get a different calcium pill. So that doesn't work very well. Vitamin D, the biggest question I get is how much vitamin D should I take? Well, the answer is there's no good answer for that. You need a vitamin D serum level. You need a blood test to know how much vitamin D you should be on. And at that point, it can be tailored to you because a lot of people, especially going into the winter in northern climates, are vitamin D deficient. What else can we do? Well, assuming we've identified that you have osteoporosis, then there are drugs to take for it. So biphosphonates, this was the standard answer 20 years ago. If you had osteoporosis, everybody was put on Fosamax. Actonel, Boniva, Reclass, they're all the same medications. Bisphosphonates have been the standard treatment for it. It's a good medication, don't get me wrong, but we can't take them forever. This is a medicine, if you take it for too long, actually causes fractures. So you can't just be given that A lot of people were treated by their gynecologist. Who do women see? They go to their gynecologist every year. They don't usually go to their internist. So gynecologists sort of inherited this business of treating osteoporosis. And sort of the knee-jerk reaction was bisphosphonates or Fosamax and Actinol. So these are controversial. There are new medicines around. Forteo is one of the new medicines, an injectable medicine every day. It builds bone. As we talked about, bone is in a constant state of breaking down and building up. And as you get older, you break it down faster than you build it up. Well, Forteo actually fixes that. It builds bone for you. It's limited to 2 years. It's a daily injection. I can swear to you it doesn't hurt. You get a little pen, you stick it in your leg, and it's not a big deal. It's actually been a great medicine and does really show improvement in bone density. Prolia, another new medicine that's out. Still, the jury's out, but it does seem to be a very good osteoporotic medication. It's an injection. And then there are all kinds. Avista, I put here, is just a estrogen analog to be used because people don't want to take estrogen anymore. It sort of tricks your bones into thinking you have estrogen around. There's a lot of discussion about it, and we could sit here and talk for hours on estrogen replacements and things like Avista, but that is one of them. And again, this talk can't go on too much longer, but here's the take-home messages. So as I told you, the internet. There's a great website where you can get a lot of information about osteoporosis. The National Osteoporosis Foundation has a very understandable, usable website. So if you sort of got a little information and said, I need more, go there. And it's very readable, and it's very useful, and it's not written just for doctors, and it's not written just for lay people. It's really useful. So I think that's 10 minutes.